They told Audra Finch she had 20 minutes to clear her locker. Gwen Sharp delivered the news herself, standing in the corridor outside Trauma Bay 2 with her arms crossed and her reading glasses pushed up into her gray-blonde hair, speaking in the flat, careful tone of someone who had rehearsed the conversation during the drive-in. There were 2 security guards behind her, men Audra had known for years, both of them looking carefully at the floor. Audra's hands were still in gloves. She hadn't even had a chance to peel them off. "You're serious," Audra said. "I am," said Sharp. "He would have died, Gwen." Sharp's jaw tightened. "He is a dog, Miss Finch. This is not a veterinary clinic. You used our equipment, our blood products, our surgical suite, without authorization, without consulting me, without so much as a phone call, and you have put this hospital at considerable legal and administrative risk." She let that settle for a moment. 20 minutes. Audra looked at the corridor around her. A handful of colleagues had stopped walking. A nursing student stood with her clipboard pressed to her chest. No one said anything. Tamsin Obi, who had been Audra's closest friend on the ward for 4 years, met her eyes from across the hall and gave a barely perceptible shake of her head. Not disagreement. Warning. Don't push it. Audra had never been especially good at heeding warnings. "His name is Dagger," she said quietly. "He's a military working dog. He's been on 2 deployments. His handler is in the OR right now because of injuries they both sustained in a training exercise this morning. Dagger was bleeding out in our ER bay. There was no time to transfer him. There was no veterinary facility open within 45 minutes, and Dr. Huot and I made a call." She pulled off one glove, then the other, slowly. "I would make the same call again." Sharp said nothing for a moment. 19 minutes, she said. 6 hours earlier, the shift had started like any other February Thursday at Brigadier-General. The hospital sat at the edge of Renfrew County, in the kind of town where the Canadian forces base up the road was not background noise, but the actual pulse of the place. The morning Tim Hortons lineup was always half uniforms. The Legion Hall was the best-maintained building on the main street, and the nurses in the ER had learned over the years to read the difference between a training injury and something worse by the particular way the MPs came through the sliding doors. Fast but measured meant serious. Fast and chaotic meant they needed everyone available, immediately. Audra had been at the hospital for 6 years. She'd come up from Ottawa on what was supposed to be a 2-year contract, fallen in love with the rhythm of a rural ER, quieter than Queensway Carleton, but never actually quiet, and stayed. She was 31, charge nurse for the last 18 months, and she'd earned that role in the way you earn things at a place like this. Not by asking for it, but by being the person others looked to when the situation outpaced the protocol. She knew the names of the pharmacy tech's kids. She knew which physicians were sharp under pressure and which ones needed a confident voice in the room to anchor them. She knew the sound of the Ottawa Valley in winter, the way wind came off the river and hit the parking lot, the way the flat white sky settled over the county like a held breath in February and didn't lift until March. The morning had been steady without being hard, a broken wrist from an icy driveway, a child with croup who scared her parents considerably more than she scared herself. 2 chest pains, one real, one anxiety that had been building for 3 weeks and finally landed in a body. Tamsin had brought muffins from the Petawawa bakery, blueberry lemon, wrapped in wax paper, and they'd eaten them standing at the nursing station because that was the only way you ever ate anything on shift, snatching bites between tasks, talking with your mouth half full, pretending to each other that this was a completely normal way to take a meal. At 11:42, the call came in from the base. Receiving casualties from CFB Petawawa was not unusual. Over the years, Brigadier-General had handled everything from a fractured femur during a PT exercise to a corporal who'd taken a ricochet fragment from a range incident. They had a protocol for it. They had a contact at the base medical center. What they did not have, what no one had thought to write, was a protocol for what happened when the military's truck pulled into the ambulance bay at noon with 2 patients, one of whom had 4 legs. The first was Sergeant Colby Ware, 28, Dagger's handler. He'd taken the impact when a training vehicle rolled during a winter mobility exercise in the backfields of the base, and the preliminary assessment from the medic who'd ridden in with him was not encouraging. Suspected internal bleeding, possible splenic laceration, GCS dropping on the way over. The moment the gurney hit the ER floor, Dr. Raoul Huot and 2 nurses were on him, and within 90 seconds he was already moving toward the OR. The second patient came in on the floor of the truck on a military-issue thermal blanket that had been soaked through with dark blood. Dagger was a Belgian Malinois, smaller than the German shepherds most people pictured when they thought of military dogs, but built like a coiled spring, fast-twitch muscle and alertness compressed into one efficient frame. He was 7 years old. He wore a tactical vest that had been partially cut away. A young private named Brenner, barely 19, face drained of color, was applying direct pressure to a wound at the dog's left flank with both hands, pressing down hard, not letting up. He went through the windshield when the vehicle rolled, Brenner said to Audra. His voice was very steady in the way voices get when someone is doing everything possible not to come undone. He hit the doorframe on the way out. There's glass still in there. He's been losing blood for about 20 minutes. I couldn't get the bleeding to stop completely. I kept my hands on it. Audra crouched beside Dagger. The dog looked at her. His breathing was shallow and rapid, his gums pale, his eyes glassy but tracking. Following her face with the kind of focused attention that is not instinct but training, the hard-won habit of looking to a human when everything else is wrong. There was still something behind those eyes, not gone yet, but working at staying. She knew what hypotension looked like. She knew what blood loss looked like when it had been ongoing for 20 minutes. She also knew the distance to the nearest after-hours veterinary emergency clinic was 43 minutes on a clear day, and today the highway south was slick with freezing rain. She stood up and looked at Brenner. Get him inside. Ma'am, I tried to call the vet clinic in. I know, she said. Get him inside now. What followed was the most unorthodox hour of Audra Finch's nursing career. Dr. Huot was in the OR. Audra paged the one physician still on the floor, Dr. Imogen Tate, a family medicine resident doing an ER rotation 4 months from finishing, told her in 30 seconds what she needed and why, and got a nod that was half frightened and half resolute. Then she called CFB Petawawa's medical center and asked for the veterinary officer. Major Darius Peck answered on the second ring. She told him what she had, what she could see, what she had available. He asked 3 precise questions about the wound location, the dog's respiratory rate, and whether the gum color had changed in the last 2 minutes. Then he started talking, and he kept talking, clear, methodical, unhurried, and he did not once ask her why she was calling from a human hospital. He seemed to understand that the question of venue had already been decided. The glass fragment had lacerated an intercostal vessel. Survivable, Peck told her, if addressed. Not survivable if left. They worked with what the ER had. Sterile drapes, instruments scaled down from the pediatric kit, saline, a unit of packed red cells that Peck confirmed would be physiologically appropriate. Tate's hands were steadier than Audra had expected. Private Brenner had been directed to the waiting area where he sat with his elbows on his knees and his face in his hands and didn't move. It took 53 minutes. When it was done, Dagger was stable. His breathing had evened into a slow, deliberate rhythm. His gums were pink. He lay on the gurney with an IV secured in his foreleg and a clean pressure dressing over his flank, and when Audra scratched gently behind his ear, his tail lifted, not a full wag, barely a movement, the smallest possible version of the gesture, but there, present. She was still standing there when she heard Sharp's heels in the corridor. Sharp had been administrator at Madawaska Valley General for 9 years. In that time, she had overseen 2 accreditation cycles, 1 construction project that ran 4 months over schedule, a labor dispute that she navigated without raising her voice, and what the hospital staff referred to, in shorthand, as the controlled substances situation, which no one discussed directly and everyone remembered precisely. She was competent. She was organized. She was the kind of administrator who read every policy document and could cite the relevant section number from memory. She was not a cruel woman. Audra had always understood that. Sharp wasn't malicious. She was a person who had spent so many years living inside institutional frameworks that she had gradually lost her ability to see around the edges of them. A dog was not a patient. The trauma bay was not a veterinary suite. The liability exposure was real and the policy violation was unambiguous, and that was, as far as Sharp was concerned, the entirety of the analysis. The security guards walked Audra through the lobby. Not roughly, but they walked her. She was aware of people watching, a woman with a toddler balanced on her hip, an elderly man waiting at the pharmacy window, a cluster of nursing students who went very still as she passed. She kept her eyes forward. She pushed through the front doors. The February air hit her like a wall. She stood on the sidewalk in her scrubs, holding a cardboard box with her stethoscope coiled on top of it, and tried to remember where she'd parked. The lot was half ice, half slush, pooling in tire ruts. The sky was the flat white of deep winter, no texture to it, just expanse pressing down. Somewhere across the river, from the direction of the base, she could hear the faint, rhythmic percussion of training exercises, a sound so familiar she'd stopped registering it years ago. She walked to her car. She sat in the driver's seat without starting the engine. She put the box on the passenger seat and looked at the stethoscope. She did not cry. She wasn't sure what she felt, and she'd been a nurse long enough to know that not being sure what you feel is sometimes the most honest thing. Not regret. Not anger. Anger would come. She understood that about herself it always arrived late, after everything else had already settled. What she felt right now was something closer to being unmoored, like a person who has been leaning against a wall for years and doesn't fully know how much weight she's been resting on it until the wall disappears. She had been a nurse at this hospital since she was 25. She had worked Christmas shifts and pandemic shifts and the kind of night shifts that end with you sitting in your car in the parking lot, not because you can't drive, but because you need 5 minutes to exist in the space between the hospital and the rest of your life. She had held hands that were very cold and talked to people in rooms where the only honest thing to say was also the hardest thing, and she had learned over 6 years how to say it. She had taken a left off the highway toward Renfrew County on what was supposed to be a temporary detour, and she had never quite made it back. And now she was sitting in a cold car in a half-assy parking lot because she had chosen to save a life. She started the engine. She did not know, sitting there with the defroster running, and both hands around the steering wheel, that 40 minutes north, at CFB Petawawa, a report was already moving up the chain of command. Major Peck had filed it the moment he'd hung up the phone. He was thorough by nature and precise by training, and the report reflected both qualities. A clear timeline, a factual account of the clinical decisions made, the outcome, and the circumstances that had necessitated a civilian ER becoming the venue. The report was not punitive in tone. It was simply what had happened. And what had happened was that Dagger was alive, and the documented alternative, detailed in the timeline, was that he would not have been. The report reached Brigadier-General Moira Ketch at 1417. Ketch commanded 2 Canadian mechanized brigade group out of Petawawa. She had been in uniform for 31 years. She had worked alongside military working dogs in 3 theaters of operation, had written 2 of the policy frameworks governing their deployment and welfare, and had attended the memorial service for more than 1 canine handler over the course of her career. She read Peck's report twice, set it on her desk, looked at the window for a moment, then made 2 phone calls. Then she asked her driver to bring the vehicle around. Audra was still at her kitchen table, still in her scrubs, mug of tea gone cold in front of her, phone face down because she wasn't ready to navigate the 12 texts from colleagues she could feel accumulating, when it rang with an unknown number from the 613 area code. She answered because it might have been HR, and she needed to not let that go to voicemail. "Is this Audra Finch?" The voice was professional, measured, unhurried, slightly clipped in the way of someone who'd spent a career on radio communications. "Yes. My name is Major Peck, veterinary officer, CFB Petawawa. I believe we spoke earlier today." Audra's grip on the phone tightened slightly. "Yes. How is he? How's Dagger?" "Stable, resting. His vitals are good." A brief pause. "Sergeant Ware is out of surgery. He's going to be fine." She let out a breath she hadn't realized she was holding. It came out longer than she expected. "Mrs. Finch, I'm calling because Brigadier-General Ketch has been briefed on the situation. She'd like to speak with you, in person, if possible." He paused. "She's actually already on her way to Madawaska Valley." Audra looked at her cold tea. To the hospital? Yes. She was quiet for a moment. I'm not at the hospital anymore. She's aware of that, Peck said. That's partly why she's going. Gwen Sharp was reviewing an incident documentation form in her office when her assistant knocked on the glass. Gwen? The assistant's voice carried a quality Sharp had never heard from her before. Careful. The specific carefulness of someone looking at something they haven't quite categorized yet. There are military vehicles in the front lot. Sharp looked up. Training liaison? I don't think so. The convoy, 3 vehicles, had pulled into the main entrance at 15:04. The staff car bore Canadian Forces insignia. When Brigadier-General Ketch stepped out onto the wet asphalt in her service dress with Peck behind her and 2 members of her staff, the cluster of people near the hospital's main entrance went very still. Ketch walked through the sliding doors with the ease of someone long accustomed to entering rooms and having them realigned. She approached the main reception desk. I need to speak with your administrator, she said pleasantly. The conversation between Ketch and Sharp lasted 22 minutes in the small meeting room off the main corridor where Ketch had requested they speak privately. Sharp entered it as the administrator of a regional hospital with 11 years of healthcare management experience and a clear institutional justification for every decision she'd made that morning. She came out of it looking like someone who had been handed a map and discovered, for the first time, that the territory was considerably larger than she'd assumed. What Ketch said, in precise and unraised language, was this. Dagger was a Category A military working dog with 2 operational deployments and a current active role in base security operations across 3 installations. He had a service record. He had a handler who was at this moment recovering from surgery in a hospital that had just terminated the employment of the nurse who had saved both of their lives within the same 4-hour window. The Canadian Forces took the welfare of its working animals seriously. It also took careful note when a civilian healthcare worker demonstrated the kind of decision-making under pressure and the kind of composure in an unscripted situation that the forces themselves spent significant time and resources trying to develop. These were qualities worth recognizing. The forces intended to recognize them. She was not there, Ketch said, to make threats. She was there to ensure that everyone with a role in this situation had a complete and accurate picture of what had actually occurred. She also mentioned in the same measured tone that the Deputy Minister's office had been informed as a matter of routine, and that a journalist from the Ottawa Citizen had already called Peck's office at 1450. Apparently after hearing something from someone on the base. Facts, the general noted, had a way of moving. Tamsin called Audra at 1531. You need to come back, she said. Tamsin. Audra, come back to the hospital. A pause, just come. She drove back in her scrubs with the cardboard box still on the passenger seat. The lot looked different. 2 additional vehicles she didn't recognize, and 3 people in uniform standing near the main entrance, not staff. She walked through the doors. The lobby had a quality to it she couldn't immediately name, not crowded, but occupied differently than it usually was. A few nurses who had been on their break were no longer on their break. The security guard at the front desk, one of the 2 who had walked her out, looked at her and then very deliberately looked somewhere else. Brigadier-General Ketch was standing near the nursing station, speaking quietly with Peck, and she turned when Audra came through the doors. Ketch was in her early 60s, silver-haired, with the posture of someone who had never once in her adult life allowed herself to slouch in a chair. She looked at Audra for a moment with an expression that was assessing without being unkind, the look of someone who is confirming something she'd already decided. Miss Finch, she said, thank you for coming. Major Peck said you wanted to speak with me. I did. Ketch extended her hand and they shook. Her grip was firm and brief. First, on behalf of the Canadian Armed Forces, I want to thank you for what you did today, for both of them. Audra looked at her. She hadn't slept well in weeks and she'd been fired 4 hours ago, and her tea had gone cold and she was still in her scrubs, and she felt, standing in the lobby of the hospital she'd worked in for 6 years, suddenly, and without warning, close to something she hadn't wanted to be close to in a public space. "How's Dagger?" she asked, because it was a question she could ask without her voice doing something she didn't want it to do. Resting comfortably, Major Peck expects a full recovery. Ketch studied her for a moment. "I've spoken with your administrator." "I'm aware I'm no longer employed here." "You were no longer employed here," Ketch said. "As of approximately 8 minutes ago, there's been a reconsideration." Gwen Sharp found Audra in the corridor outside Trauma Bay 2 at 16:05. She was alone this time, no security guards, no audience, and she was carrying a manila folder. She stopped in front of Audra and did not immediately speak. The composure was intact, but something sat behind it that Audra did not usually see there. The particular discomfort of a person who is not accustomed to arriving at a situation after the fact and finding that the situation has already understood itself without her. "The decision this morning was made in haste," Sharp said. Audra waited. "The hospital will be reinstating your position. Full back pay. Your file will reflect no disciplinary action." Sharp looked at the folder, then at Audra. "I want to be clear that the administrative concerns were legitimate. The liability questions were real." "I know they were," Audra said. "But," Sharp stopped, began again. "The outcome of your decision was what it was, and I was not working with a complete picture this morning." She held out the folder. "It was not an apology, exactly. It was the closest approximation available to a person like Gwen Sharp on the same day the events had occurred, in a corridor, without preparation, and Audra, who had worked in the same building as this woman for 6 years and understood her particular limitations the way you understand the limitations of any familiar landscape, recognized it for what it was. "All right," Audra said, and took the folder. Tamsin brought her a fresh cup of tea at 16:20. They stood together at the nursing station and watched the military vehicles pull slowly out of the lot, one by one, until the entrance looked like itself again. Someone had propped the door to the trauma bay open. Through the gap, Audra could see the gurney, stripped and freshly made, ready for the next patient, no visible evidence that anything outside the ordinary had passed through it. The hospital was already reconstituting itself around the day, the way hospitals always do. Someone needed something. Someone answered. The work continued forward, regardless of what had just happened in the margins. Tamsin nudged her arm. "Better than TV," she said. Audra laughed, short, unprepared, real. She thought about the moment Dagger's tail had moved. Just barely, just enough. She thought about Private Brenner with his face in his hands, refusing to move from outside that bay. She thought about Sergeant Ware in a recovery room somewhere in this building, alive. She thought about Major Peck's voice on the phone, precise and steady, guiding her through something that had no business happening in a place like this and was happening anyway. Because that is the shape that necessity takes. It shows up where it shows up, and it doesn't wait for the right venue. She thought about what it meant to make a call, a real one. The kind you make before you know the outcome, in the space between what the protocol says and what the moment requires, with a life in front of you and no one else within range to make it for you. She put her badge back around her neck. Tamsin was already talking about the documentation they'd need to complete before end of shift, and Audra was listening, and outside the flat February sky was going gray-orange in the slow, grudging way it moved toward dusk in the Ottawa Valley, and somewhere on the other side of the river, in the care of people who understood exactly what he was working. A Belgian Malinois with a bandaged flank and 2 deployments behind him was breathing slowly and resting. He was going to be all right. So was she.